This presentation is aimed at dog grooming professionals who want to use an ultrasound toothbrush to offer teeth cleaning as an add-on service. The information and guidance in this presentation could also be useful for any dog owner who wishes to use an ultrasound toothbrush to maintain their own dog's dental health. In this lesson, we are going to look at dental anatomy in dogs, common dental conditions, the pathogenesis of periodontal disease, how to carry out an oral health check, and how to keep dental records. Due to selective breeding in the domestic dog, there are 3 different head shapes in recognised breeds today. Mesocephalic is having a head of medium proportions, seen in breeds such as the Beagle, Dalmatian, Cocker Spaniel and Border Collie. Brachycephalic is having a relatively broad and short skull, typically with the breadth at least 80% of the length, seen in breeds such as the Boxer, Boston Terrier, French Bulldog and English Bulldog. Dolichocephalic, having a relatively long skull, typically with the breadth less than 80 or 75% of the length, seen in breeds such as the Whippet, Greyhound, Rough Collie and Flatcoat Retriever. Groomers will know that a brachycephalic head shape can affect the dog's ability to breathe easily, but different head shapes can also affect oral health. Dolichocephalic breeds can have problems with eye formation and can have an overbite. Brachycephalic breeds can have less space for their incisor teeth to fit properly, so can have crooked teeth, malocclusions and an underbite. Being aware of these potential problems will help you to identify them during an oral exam. The different skull shapes affect the dog's bite. The correct bite is the scissor bite, where the upper teeth slightly overlap the lower teeth, normal for mesocephalic breeds. Dolichocephalic breeds are often overshot or have an overbite. Brachycephalic breeds are often undershot or have an underbite. Some dogs may also have a pincer bite, where the teeth meet together rather than slightly overlapping. This can cause the teeth to grind and wear down to stumps as the dog ages. Terriers are bred to have a vice-like bite, which refers to their strength and grip to hold on to their prey rather than the alignment of their teeth. Conversely, gun dog breeds like Spaniels are bred to have soft mouths, so they don't damage the prey's meat when they retrieve. All adult dogs should have 42 permanent teeth. Puppies have 28 teeth that erupt at around 6 weeks of age. Puppy teeth are called deciduous teeth, and adult teeth should have replaced all the deciduous teeth by around 7 months of age. Retained deciduous teeth can cause rotation and malocclusion of permanent teeth and can prevent successful cleaning, leading to periodontal disease and/or tooth loss. Deciduous canine teeth are the most likely to be retained. During an oral exam, the teeth should be counted. The triaden system of counting teeth is pictured here, where each tooth has a 3-digit number. The first digit indicates the quadrant of the jaws. The maxilla is the upper jaw, and the mandible is the lower jaw. The dog's right upper jaw is number 1. The dog's left upper jaw is number 2. The dog's lower left jaw is 3, and the lower right is 4. Start at the right upper and go in a clockwise direction. The next 2 digits indicate the tooth in the quadrant. Starting at the middle incisor, count from front to back. There should be 10 teeth in an upper quadrant and 11 teeth in a lower quadrant. The canine tooth should always be number 4. An alternative charting sequence is the proper identification sequence, which uses abbreviations for the quadrants and teeth. Adult dogs should have 12 incisors, which are used to bite, 4 canines, which are used to tear and shred flesh, and 26 premolars and molars to shear and crush meat. Here is a diagram of the tooth formation. The crown is the most visible portion of the tooth and is primarily made of enamel and is subject to wear, fractures and discoloration. Wear is caused by chewing on hard items, and fractures are caused by trauma. Trauma can also cause discoloration. Pink and red would mean a hemorrhage from the pulp. If left untreated, the pulp may die, resulting in crown becoming purple, grey or black. Enamel is the strongest surface in the body and is primarily made of minerals with a small amount of water and organic matter. It is shiny and varies from white to ivory. Enamel is brittle, and enamel chip fractures are common if the dog chews on hard things. Enamel cannot repair itself because there is no blood supply. The cementum's connective tissue provides nourishment, allowing it to repair through life. The pulp is the most vital portion of a tooth. Without it, the tooth would die, and is made up of veins, arteries, lymphatic vessels, which are thin tubes that carry lymphatic fluid and white blood cells, nerves, odontoblasts, which secrete dentin, and other cellular structures. The structures of the pulp provide nourishment, sensation, and defense. The root anchors the tooth. Tooth roots contain living tissues of the tooth. In dogs, the maxillary fourth premolar and the first and second molars have 3 roots. The periodontal ligament attaches the tooth to the alveolar bone. The lymphatic system is the organ system in vertebrates that is part of the circulatory system and the immune system. Lymph nodes are located throughout the dog's body and help to fight infections and disease. Dental conditions, gingivitis, and periodontal disease can manifest themselves with enlargement of the adjoining lymph nodes, the mandibular lymph nodes. During the oral exam, hold them simultaneously and check for symmetry. Any enlargements should be recorded and referred to the vet. Periodontal disease is a bacterial inflammation of the periodontium or periodontal tissues. Periodontal tissues are the structures that hold the tooth in the mouth. Periodontal disease is the most common oral condition in dogs. Periodontal disease is divided into 2 separate conditions, gingivitis and periodontitis. Pathogenesis means the way a disease progresses. It's outlined below, and we're going to discuss it in a little bit more depth. The pellicle is a thin film consisting of salivary proteins and glycoproteins that protect the enamel against abrasion attrition, which is the process of reducing something's strength or effectiveness through sustained attack or pressure. It serves to lubricate the teeth, and as the pellicle ages, it gives oral bacteria a surface to adhere to. Plaque is a microbial biofilm. When food remains on the teeth, bacteria colonize on the pellicle and cause the formation of the microbial biofilm. Plaque can only be seen with the naked eye by using a plaque disclosing solution. If teeth aren't brushed with toothpaste to remove the plaque, bacteria multiplies and causes the biofilm to thicken. Plaque disclosing solutions for pets can only be obtained by vets, but you can buy disclosing tablets for humans over the counter, and you may find it interesting to try them on yourself after brushing your teeth to see what plaque has been left behind. Calcium salts are found in the salivary fluid. They crystallize on the surface of the teeth and mineralize the soft plaque, making it harden. Dog and cat mouths are slightly alkaline, unlike humans, which makes it likely that calcium salts can be deposited. The formation of dental calculus takes 2 to 3 days, so daily brushing with toothpaste would be required to prevent the formation of dental calculus, just as we do our own teeth. Once formed, dental calculus can only be removed by mechanical action, so either power scaling by the vet or the use of an ultrasound toothbrush. Plaque extends below the gum line, which is called the gingiva. Bacteria become destructive to the periodontal soft tissues, which causes inflammation, and gingivitis develops as a result. Dental calculus promotes the growth of anaerobic bacteria. Gingivitis is reversible. Once the bacteria-laden plaque is removed, the inflammation should disappear. An ultrasound toothbrush can destroy bacteria under the gum line. Gingivitis is the first stage of periodontal disease, and it is the only stage that can be reversed. If the inflammation does not go away, periodontal disease has reached the second stage and cannot be reversed and requires management by the vet to prevent it from progressing. Stage 2 of periodontal disease is early periodontitis. Periodontitis is the inflammatory destruction of the epithelial barrier that protects the tooth support structure. The support structures is the gingiva, cementum, periodontal ligament, and the alveolar bone. As the bacteria below the gum line move deeper into the periodontal tissues,
oxygen becomes unavailable and the bacteria become more destructive. The epithelial barrier breaks down and the gingiva separates from the alveolar bone. As the bacteria move towards the root, the periodontal ligament and the alveolar bone are destroyed. As more of the support structures are affected, tooth mobility will be visible. Pathogenic bacteria cause the body to activate immune and non-immune reactions that are responsible for the tissue damage, so all dogs will develop plaque, but not all plaque will cause periodontitis. This picture is of a senior Springer Spaniel that had never had any dental work. In addition to the tartar build-up, there was some gum recession as the gum moved away from the tooth when it was touched, bleeding at the touch, and some tooth mobility. This was likely to be moderate to advanced periodontitis. This dog was referred to the vet for treatment and was likely to be in a lot of pain. Signs of periodontitis include bad breath, gingival inflammation, gingival recession, root exposure, presence of pus or discharge, dental calculus, which we know is tartar, discomfort at being touched around the mouth or when eating or chewing. All signs of periodontitis must be referred to the vet. This chart has been created to help guide you to deciding whether or not it is safe to clean the dog's teeth or to refer it to a vet first. On this dog, we can see a dark red line at the gum line and inflammation of the gingiva. The tartar is covering less than a third of the tooth's surface. This dog's teeth were cleaned in a 30-minute session using the Emmi pet toothbrush, and a rosewood stick was used to gently lift the tartar away from the gum and tooth. At the end of the session, the dark red line was already starting to fade. The colour of the gingiva was lightening to a healthy pale pink, and the inflammation was starting to reduce. After the session, there was no visible tartar left behind. In contrast, this dog's teeth have tartar covering more than 2/3 of the tooth surface on most of the teeth, and the gingiva is dark red and inflamed, suggesting the dog could have moderate to advanced periodontitis. This dog's teeth were not cleaned, and the owner was advised to seek prompt veterinary treatment. Endodontic disease occurs when the tooth's pulp sustains damage and requires veterinary treatment. If the pulp is damaged but not destroyed, it's possible for the tooth to be saved, but in most cases of endodontic disease, the pulp does not survive and may also develop an infection as it decays. Pulpitis is inflammation of the pulp. Dogs that chew hard things, police dogs that do bite work, and dogs that do agility or flyball are all more at risk of endodontic disease, so a history of the dog is useful. Endodontic disease is painful, but pets can hide their pain until they can no longer compensate. Symptoms of endodontic disease include salivation, lack of appetite, an inability to eat or drink properly, lethargy, odour, swelling or redness, a reluctance to chew, an inability to close the mouth properly, reluctance to play or be stroked, changes in socialization, dropping food whilst eating, vocalization with oral activity, ear and ocular pain, ocular discharge, and discoloration of the tooth. An oral tumour is a visible growth or abnormal mass that is not inflammatory. All oral tumours should be reported to the owner, who should be urged to seek veterinary diagnosis and treatment. Symptoms that could be linked to oral tumours include oral bleeding, difficulty swallowing, bad breath, weight loss, hypersalivation, nasal discharge, and swollen lymph nodes. Peripheral odontogenic fibromas are typically slow-growing and are usually found in the gum tissues in middle-aged to older dogs. Odontomas are considered rare and look like tooth-like structures that develop in younger dogs. Gingival hyperplasia is a gingival overgrowth and is commonly seen in boxers and bulldogs. Papillomas are viral in origin and are contagious, transmitted by direct contact. They typically affect younger animals or those with weakened immune systems. They are found on the gingiva, lips, tongue and/or palate. Range in size, can be pink or white, be singular or clustered and have a rough surface. Their appearance can be likened to that of a sea anemone or a cauliflower. Always refer to the vet if you are unsure before you carry out any teeth cleaning. Malignant tumours are cancerous cells that invade and kill nearby tissues and spread to other parts of the body. Malignant melanomas are rapidly growing, discrete masses that can be found on the gingiva or buccal mucosa, which is the surface of the cheeks and lips. Cocker spaniels, miniature poodles, and chow chows are more susceptible to malignant melanomas than other breeds. SCC is the second most common form of skin cancer found in humans, usually on areas of UV-damaged skin. It is the most common malignant oral tumour in cats. A fibrosarcoma is a soft tissue sarcoma, which are a group of cancers that can be found in the nasal cavity and mouth. Please refer all lumps to a vet for diagnosis. The purpose of carrying out an oral exam is to determine if it is safe to carry out teeth cleaning with the ultrasound toothbrush. Remember, under the Veterinary Surgeons Act 1966, only a vet is permitted to diagnose a health condition or disease. It is also important to remember that denying an animal veterinary treatment is an offence under the Animal Welfare Act 2006. Do not feel pressured to carry out teeth cleaning because you believe or know that the owner will or has refused to seek veterinary treatment that their animal requires. Regular exams can help recognise the pathology of diseases and prompt veterinary attention. Owners rarely look in their dog's mouth and often miss poor oral health conditions. To carry out the exam, the dog needs to be safely restrained on the table, as it would for a grooming health check. Once the dog is established and settled on the table, the exam can begin. You should be wearing appropriate PPE such as gloves, an apron and a mask. Stroke the dog and assess for signs of pain and reactions to being touched around the mouth. Always maintain your own safety. Remember, if a dog is in pain, it may show an aggressive reaction to touch. This should be reported to the owner for further investigation by the vet, and the exam should be stopped at this point. Before you begin the oral exam, ask the owner questions about the dog's health history. Ask if the dog has received veterinary treatment in the past and what for. Ask if the owner has any current concerns about their dog's health. Ask if the dog does any activities like chewing and on what, if they do flyboy or agility. Then carry out a behaviour assessment and observe how the dog reacts to touch. Make a note of any signs of ill health the owner has observed, such as reduced appetite, weight loss, difficulty eating or shying away from food, chewing on one side only, halitosis, drooling, pawing or rubbing their face, crying when they yawn or pant or when their mouth is open. Check for asymmetry of the face. Check for swellings of the face or lymph nodes and or the salivary glands. Count the teeth as detailed previously, starting at the middle incisor and counting the teeth in each quadrant. Record any missing teeth. Measure the tartar or the dental calculus. Record your findings. Observe for a red line on the gum line on the gingiva. Using a dental probe or your flicking tool, just touch the gum line and look for any bleeding. Using a dental probe or your flicking tool, touch each tooth as you count them and test for mobility. Record any mobility and report this to the owner. Any mobility other than normal mobility should be investigated by a vet before teeth cleaning is carried out. Record any retained puppy teeth and refer them to the vet. The dog will have to go under anaesthetic to have the teeth removed, so it would be advisable for the vet to do the teeth cleaning at the same time and for an ultrasound cleaning to be done after as a preventative measure. Check for any oral tumours or lumps. Observe the whole mouth where possible on a live dog without putting yourself in danger of being bitten. An annoyed dog or one that is suffering from pain may bite. Record any observations and report to the owner for prompt attention by a vet. Check for malocclusions. Record the teeth that aren't positioned correctly so they can be monitored more closely for tartar build-up. Check for any obstructions. It's not unheard of that a stick or bone has got stuck somewhere in the mouth, such as the roof of the mouth, or when the dog has chomped on a bone or a stick. I have personally found a standard poodle with a swelling on the throat, and it had a piece of conifer lodged there. So don't let anything go amiss and don't hesitate to report to a vet. Pictured here is an example of a free downloadable canine dental chart for you to record your findings and keep up to date on any changes in the dog's mouth between visits. You can record the amount of tartar that you've witnessed on the teeth by using these abbreviations below. If gingivitis is observed, you can use the following abbreviations to record it per tooth. When observing the gums, you can also do a capillary refill test and assess the colour of the gums. Healthy gums should be pale pink to pink in colour to indicate good blood flow. Unusually pale gums could indicate a health condition such as anemia. Red, bluish or grey tinged gums should be taken to the vet as a matter of urgency. To test the capillary refill time, press your finger onto the gum and release. The normal colour should return within a second or two. If it is slow to return, the dog should be taken to a vet quickly. Capillary refill is a quick method to assess blood flow, and poor capillary refill can indicate health conditions such as dehydration or shock. Wobbly teeth should be seen by the vet. Tooth mobility means the tooth has suffered trauma or periodontal disease has caused the destruction of the tooth support structures. It can be recorded on the chart as M0 to 3. Tooth mobility is the measurement of how much a tooth moves from its axis in millimetres. As a groomer, any movement should be referred to the vet. Deciduous canines are the most common tooth to be retained. Retained puppy teeth can cause occlusion problems as well as increase the risk of periodontal disease. Dogs with retained puppy teeth should be referred to the vet if the dog is over 7 months of age. Be sure to record them on the chart. Other reasons to refer to a vet before carrying out teeth cleaning include the following: enamel hypoplasia, an abbreviation of EH on the tooth chart. It's a loss of enamel on the tooth surface. This would need x-rays and treatments such as sealant, composite restoration, extraction, or crown replacement by the vet. Trauma. This can result in fracture, pulpal hemorrhage, disruption of blood supply, luxation or avulsion, which is the complete displacement of the tooth. Caries. Caries appear as a small black dot on the crown and are demineralization of hard dental tissues from acids created in plaque. Caries usually present as small black lesions on the enamel, but are uncommon in dogs. Root exposure. This occurs when gingival recession and bone loss occur around the tooth. Regular oral exams during regular grooming sessions will likely mean the groomer is the first to notice changes with their observations and teeth charts and enable us to prompt vital veterinary treatment. Regular ultrasound teeth cleaning with a grooming session or on its own can prevent dental calculus build-up and thus prevent the development of periodontitis. Without an ultrasound brush, the owner would need to clean the teeth twice a day like we do to clean away the plaque and prevent it from calcifying and forming tartar. To recap, here's when you shouldn't clean the dog's teeth. If there are signs of stage 2 to 4 of periodontal disease, any sign of endodontic disease, any sign of an oral tumour, enamel hypoplasia, caries, any root exposure, any tooth fractures or trauma, or any signs of vet pain. If in doubt, refer to the vet. After the vet has treated the suspected health problem, teeth cleaning can continue to prevent further problems from developing. Always ask permission to speak to the client's vet if the dog has received treatment and get permission to clean the teeth. It is estimated that 60% to 80% of dogs over the age of 3 have some stage of periodontal disease, and remember, only a vet can diagnose it. Time to clean. Before using an Emmi Pet toothbrush, it's important to have a basic understanding of how an ultrasonic toothbrush works. Many electric and sonic toothbrushes are available to humans for cleaning our teeth with twice a day. An electric toothbrush may vibrate or have brush heads that rotate. Sonic toothbrushes vibrate at high speed to move bristles side to side without causing abrasion. Sonic vibrations are audible to the human ear, and we can see the vibrations. The human ear can detect around 20,000 Hz. Anything above that is classed as ultrasound and cannot be heard by the human ear. Ultrasonic brushes create vibrations that cannot be heard by the human ear, therefore they create ultrasound. Ultrasonic toothbrushes require ultrasonic toothpaste because it acts as the coupling medium which conducts the ultrasound frequency from the toothbrush to the tooth. The ultrasonic waves cause cavitation bubbles, which is a reaction that causes vapor-filled cavities in liquid, creating tiny bubbles in the toothpaste. It's important to use the Emmi Pet toothpaste because it doesn't contain any abrasive ingredients, and it is a proven conductor of ultrasound waves. A dog would not tolerate the use of a sonic toothbrush, and the effectiveness would not be comparable to the results achieved by the Emmi Pet toothbrush. So, you've carried out an oral exam and you are satisfied the dog is suitable and ready for teeth cleaning. Always follow the manufacturer's instructions, and here is our suggested step-by-step guide how to do it. You will need an ultrasound toothbrush, ultrasound toothpaste, which is safe for dogs, a ramekin full of clean water, and a rosewood stick. Rosewood sticks are for single use, and you will need a means of sterilizing the rest of the equipment after each use. Once you've finished the oral exam, take photos of both sides of the mouth and any areas of concern and complete your dental chart records. Even if you don't carry out the cleaning, you are obliged to keep these records within the Data Protection Act and GDPR. As a minimum, they should be stored securely for 6 years. You should never share photos or personal information without the customer's consent, and you should only contact them for marketing purposes if they have previously given you permission to do so. So, back to the brush. Thoroughly wet the brush and have your ramekin of water nearby, so you can regularly dip the brush head into it. Apply your toothpaste to the toothbrush and press the toothpaste into the bristles to prevent it from being swallowed straight away. It is safe for dogs to swallow it, but is required to conduct the ultrasound for effective cleaning, so reapply as necessary. Turn the brush on and ensure you're regularly checking the power light for timing out. Hold the brush gently against the tooth for around 30 seconds, or longer if there is a tartar build-up. Just hold it there, don't brush. Then work your way around the teeth to cover the whole of the tooth, including the gum line. Clean each tooth independently. Work your way around all the teeth, including the gums, because the ultrasound can destroy bacteria beneath the gum, which is how it can prevent the destruction of the periodontal soft tissues and thus prevent the development of periodontal disease. Remember, always read the manufacturing instructions because there may be some differing information in there. After you've cleaned all the teeth with the brush, you can then try to remove the tartar because the ultrasound should have broken down the tartar, making it adhere less to the enamel. You can use a rosewood stick, which are for single use, or a cuticle pusher, which you can then sterilize after. Don't use a tooth descaler because they are sharp and could scratch the enamel, and they could also cut the gum. Only continue at this point if the dog is still tolerant of the teeth cleaning, if it isn't showing any signs of stress or pain, and never put your hand inside the dog's mouth. Hold the dog's mouth securely with your thumb at the bottom of the dog's tooth that you are working on. Take your chosen tool and place it at the gum line, trying to get underneath the tartar, and try to lift the tartar away from the tooth. This is the flicking action. Always move away from the gum and keep your thumb in place in case you slip with the tool and prevent catching the lower gum. You may have to apply some gentle pressure to get under the tartar. If it's still adhering firmly to the enamel, go back to using the brush for longer and try again. You may not get all the tartar off in one session. You can advise the owner to offer the dog some hard treats like fish for dogs to remove some of the tartar left behind before it hardens again. Remember that tartar will continue to form when the dog eats, so if there is a lot of tartar left behind, the dog should come back soon to finish removing it, or else the periodontal disease won't have been prevented as successfully. Beware that harsh hand scaling could cause etches in the tooth enamel and create a hospital environment for new plaque formation and retention. Professional polishing can only be achieved using veterinary tools anyway, and suitable training. Prevent causing etches in the tooth enamel by not hand scaling with sharp metal instruments or using a harsh scraping action, and this also prevents damage to the gums. Groomers regularly use disclaimers for things like matted dogs, and it's wise to have one for teeth cleaning. Many owners are reluctant to put their pet under anaesthetic, either due to the cost or the risks, but vets take precautions to minimise the risk of complications under anaesthetic, and the risk of death is very low. If veterinary treatment is required, avoid letting an owner put you under pressure to clean the teeth as an alternative treatment. If you clean the teeth under those circumstances for fear they won't take their dog to the vet, then you and the owners are breaching the Animal Welfare Act 2006 by denying their dog veterinary treatment.